Good afternoon. I'm Sean Yao, and this is One News Now. President Duterte is confident that most cities will meet their COVID-19 vaccination targets before Christmas. In his speech on Tuesday, the president said the country is on its way to having 50% of all adults fully vaccinated. The president also said the vaccine supply continues to arrive, with a total of 104 million doses expected by the end of October.
We are confident that if not all, we are confident that most, if not all, cities in the country will be hit and even surpass the target before Christmas.
And the OCTA Research Group also sees no major COVID-19 surge for the rest of 2021. OCTA fellows Guido David and Ranjit Rai told the chiefs that the current downtrend of cases could signal a merrier Christmas. They also noted increased vaccination coverage should push the chances of a better Christmas experience for all. However, OCTA warns against complacency, saying that the public should continue to follow minimum health protocols.
We're not saying it's not possible, but we're just saying that the chances of that have significantly lessened. It doesn't mean that we should be complacent, as Professor Ranjit says. We should still be, focused on keeping these cases, reducing these cases down to a very, very low level.
And the Justice Department has released details on at least 50 cases of drug war-related deaths involving police officers. According to this matrix, a majority of the incidents were from buy-bust operations. Some of the incidents also took place during the implementation of search warrants, while others happened at checkpoints. Most of the deaths reviewed by the DOJ happened in the province of Laguna. Some cases were also logged in Cavite, in Agusan del Sur, and Cagayan. The most notable case that was recorded is that of Carl Arnaiz, who was killed in Caloocan back in 2017. Police officers involved in these incidents were found administratively liable and meted penalties, mostly though just suspensions. The names of officers, however, were not indicated. We're going to pause for a quick break, but we will be back with more stories after that. Keep it here on One News. You're back on One News Now. I'm Sean Yao. Health workers are seeking greener pastures abroad due to the low salary and lack of benefits offered here in the Philippines. Camille Samonte with their stories.
Nurse JM has been working at a hospital in Metro Manila for over 3 years. When the pandemic started, JM had to take care of more than 7 COVID patients due to a shortage in staff.
During this pandemic, na-burnout na lahat. There will be some days or majority of the week na absent yung kasama mo, may sakit yung kasama mo, buong unit nyo naka-quarantine. So, paano aandar ang hospital?
With the long work hours, low salary and lack of benefits, burnt out eventually got the best of JM, pushing him to resign. He is now applying as a nurse in UK, where salary for health workers is much higher.
It ranges from 1.7 to 1.8 million per year. So sino ba namang Pinoy ang hindi maiengganyo?
JM is just among the thousands of health workers leaving the country to pursue jobs abroad. According to the Private Hospitals Association of the Philippines, a possible shortage in medical frontliners may be in the offing. PHAPi noted that around 3,000 nurses have filed resignations to work abroad.
Tuloy-tuloy yan ng mga around 3,000 or 3,000 or more. Baka in the next 6 months na ganon, mauubusan talaga tayo ng nurses or mawalan tayo ng mga nurses. Talaga mapipilay ang mga hospitals.
One private hospital in Quezon City saw over 200 resignations from health workers since January this year. Some of them didn't apply overseas but moved to different industries.
Yung iba naman, nilipat na lang ng call center kasi mas malaki ang offer sa call center kaysa magtatrabaho dito sa ospital. At yung iba naman, dahil nahawa yung buong pamilya, pagbalik nila, nag-file na ng resignation.
With this, PHAPi is urging the government to lessen the deployment cap for health workers allowed to work overseas, especially now that there are only few nursing graduates and board exam passers.
Dapat siguro bigyan ng counting subsidy ng government ang ating mga health facilities para naman matulungan sila na mabigyan ng more benefits ang ating mga nurses at nang hindi na umalis. And at the same time, siguro bigyan natin ng mas lower na cap, yung paglabas nila.
For News 5, Camille Samonte, we are One News.
Let's take a quick look at today's other top stories. Attorney Ferdinand Topacio, the counsel for formerly Director Lincoln Ong, has warned the Senate against seeking arrests in relation to the Blue Ribbon Committee inquiries. Topacio insists that a person outside the Senate cannot be arrested unless there is a standing warrant issued by the court. The Commission on Higher Education says that less than 1% of college students and faculty holding limited in-person classes have been infected by COVID-19. CHED Chairman Prospero de Vera said all of the cases were asymptomatic and none have died. In sports, defending champions the Milwaukee Bucks and the Golden State Warriors scored opening night wins today. Giannis Antetokounmpo picked up where he left off and finished with 32 points, 14 rebounds, and 7 assists to lead the Bucks over Brooklyn 127-104. In the other game, Steph Curry notched a triple-double despite a bad shooting night to lead the Warriors past the new-look LA Lakers 121-114. For more updates, visit News 5, The Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. Masks on, wash hands, and stay safe, Philippines. I'm Sean Yao. We are One News.